Well,
As soon as you're ready, it's 8:04, so we can get started.
sure, that'd be great. Thank you. I'll let you introduce us though, okay? Usual.
Julian, can you please hit the record button?
Is recording.
Oh, okay, thanks.
Yeah.
Hi, everybody, and welcome to our September Public Health Preparedness webinar. We're really excited to kick off another year's worth of webinars. As I mentioned in the announcement, this is something that we do on the first Wednesday of every month at 8 p.m. Normally, we bring in some sort of a public health preparedness, homeland security speaker who can talk about what they do, their field, how they got there, and things like that. But in September, we like to kind of bring things a little closer to home a little bit, talk about our program, give a little bit of an introduction and talk a little bit more about some of the opportunities and things for you as you move through. So I'm Jen Osatek. I have been with this program a lot longer than I like to count, but I got my master's through this program and then just never left. So I TA'd, I did curriculum development, I taught some of the intro classes, which I still do now. I teach 410. And then once I got my PhD, I expanded to teach some of the upper level courses, including 810, which is an elective on non-medical obstacles to public health responses, our critical infrastructure class, and also some of the electives that we like to offer in the summer. Along with Dr. Lengerich, I'm his assistant director for our option, and we have a lot of a lot of really great stuff planned for our option and our program that we look forward to sharing with you over the course of the next few months. So, Dr. Lengerich.
Great. Thank you. Thanks, Jen. Um, yeah. Jen, sorry, you were so formal there and called me Dr. Lengerich, and here I am calling you Jen. So please, we're going to, if you would, just humor me and we'll go by first names.
Sure.
This is a smallish crowd. So can everybody, Matthew, Yuji, and Adriana, say something about yourself or where you're at or what you want to know tonight? Anything? You can either drop a note in the chat or pick up the microphone and speak out.
Hi, good evening, dear professors and maybe colleagues. I'm a new PhD student majored in epidemiology, and I'm here to learn your research direction and get inspired. Yeah, that's all. Thank you.
That's great. Good. Are you in Hershey?
Yeah, I'm in Hershey.
Okay, great. Good. Okay. Adriana, looked like you went off mic there for a moment. You want to jump back on?
Yeah, my name is Adriana Murphy. I'm currently a Homeland Security and Public Health Preparedness student. I'm actually currently in Raleigh. I'm at work right now, so I had to step off the floor and listen to this really fast. But yeah, I'm very excited for this program. I'm really interested in like biothreat analysis. That's kind of the field I want to get into. So I'm excited.
Good. Thank you. Well, I lived in Raleigh for 7 years, 91 to 98. Yep. So I know it well. We lived up on the northern side of Raleigh.
Just to let you know, if I know you said that you're at work and you needed to step off, if you need to run back, we do record these and we post them. I've got the information in here. And I'm going to post the link and everything in an announcement in our class. So if you have to drop off, you can still get all the information.
Perfect. Thank you.
You're welcome.
Matthew, you want to drop a note in the chat or go off mic? There you go. Go ahead.
My name is Matt. I am a first semester in the Homeland Security Public Health Preparedness option. I'm from the Hershey, PA area, and I'm interested mainly in emergency management with either like a health system or the government. Not sure which side of it yet. But I think the biggest thing I'm interested in is the capstone project and kind of the best ways to prepare leading up to that.
Okay. Yeah, we will get into that too. Good. Thank you. Thanks. Julipal's kind of quiet, but he's always there and preparing things for us. He's our instructional designer par excellence for not only tonight's seminar series, but for the entire PHP program. So you will maybe get to know him, but you will certainly see his product and you'll sense his continuous presence within your courses. Us faculty run to him often to help us out. And so you may not see him all the time, but he certainly is right there behind everything that we're doing. So great. So yeah, as Jen said, we do seminars on the first Wednesday of every month during the academic year at 8 p.m. Eastern Time. So this is the first of this year. Often we have an introduction from the library, just an orientation, but we chose not to do that. And we did have a really exciting new faculty member coming on board to talk about what he does for Penn State University. He directs Lifeline, which is all of the emergency medical services out of Penn State Milton S. Hershey Medical Center. And Matt, that may be somebody that you really want to check out. So he's one of our newer faculty members, and we have several others that are also in the emergency management supply chain field for Penn State Health and the Milton S. Hershey Medical Center. So anyway, so yeah, what I was saying was that Keith could not join us tonight. He had something he had to present to a local township, and so we volunteered to let him go. He's going to come back in a future date. And right now we're going to give a bit of an overview to the whole PHP option program here, some of the things that we do. And please interrupt us if you have questions. This is going to be, this is intended to be informal. And I think we will address a couple of the questions that you all already raised here. So let me share my screen.
And when he's sharing a screen, you are going to have plenty of questions throughout your time with us. So after tonight, do not hesitate to send us an email, drop us a line. We can, we can email, we can chat, we can Zoom. So we are always available if you've got questions, need advice, or anything like that. So please know that we are always here.
Yeah, very good. So does the slide appear appropriate? Okay, good. We're on. So again, this is Public Health Preparedness at Penn State, September 4th. As we said before, I'm Eugene Lengerich. I'm a professor in public health sciences and the option director, and Jen is an assistant professor and assistant option director. But she's been with the program much longer than I have. She was a student, then a TA, and now a full faculty member, as well as the assistant option director. So she knows more about this program than I think most other people do, including me. And she has a great one for ideas too, and she will be keeping up with all of you. That's just her style, and I really appreciate that. So just a really brief overview. So public health preparedness at Penn State. Our mission briefly is just to prepare public health leaders, give them knowledge, competencies, a network, and a professional network in which they can operate when they leave here. Eugene, this is a professional program, so research is not our primary mission. However, we do encourage and we do have some forays into the research field as well, but it is a master's degree, a Master of Professional Studies. So being a research program is not our primary intent. We began in 2006, so we are approaching our 20-year anniversary here. This is a really unique collaboration between Penn State University and Penn State Health and the Milton S. Hershey Medical Center and all of the other hospitals that are part of Penn State Health. So we're really proud of this, and we think that our program has a very unique opportunity and place to play in the real world of public health preparedness. It was the first, and as far as I know, the only Homeland Security degree offered in a medical college. So I think, again, there's a unique niche for us. It is totally online, mostly asynchronous. A few courses do have some synchronous components to them, but it's mostly asynchronous, and it's offered through the World Campus. As I said, we do offer a Master of Professional Studies in Homeland Security, Public Health Preparedness. It is 33 credits. There are two graduate certificates, one in public health preparedness and another in hospital and health system preparedness. And students often see these as stepping stones to the master's degree because all of the credits that you would be required to take for either of those certificates would count for your master's degree. And the other thing to say too is we have had students taking our program and then matriculating after an application that's accepted, matriculating into a PhD or a DRPH program as well at Penn State. So they talk to us about how to help make that happen. If you choose your electives wisely, that can be a little more easy for you to transition, but we really do try to help people transition into the next degree, either a PhD or a DRPH, as they're moving forward. And again, this is a master's program, so that's not the primary outcome for our students. So for students, we do admit on a continuous cycle. So even though the website says there is a due date, that is merely for the Penn State Graduate School expectations, but we do typically review all applications and get a response back within 2 weeks. So we do try to move pretty quickly on those. We do have a diverse set of students. About 25% are sort of in the hospital healthcare field, 25% in law enforcement or military, another 15% in public health, emergency response, and then 20% in varied backgrounds. For example, we've had school teachers involved in our program. And again, a very high employment rate. Many students come on board already in a career, and so this is meant to, this allows them to move to the next level. This is most of our faculty here. So you've already met myself on the top left there and Jen over on the top right. As you can see, Jen is a master of many courses, as well as being the assistant director there. Two of our key faculty are in the center there, Zhengmen Qian. He actually lives in St. Louis. He teaches 527 and has for many, many years. He was the chair of the Department of Epidemiology at St. Louis University. He just recently stepped down from that to do some other things, but he has been teaching our course on epidemiology and evaluation for quite a number of years. Gavin McGregor Skinner, you will meet him in our program. He teaches 3 courses, a different one each semester, and you will meet him at least virtually. You never quite know where he is because he travels the world doing outbreak investigations, training hospital personnel, assisting governments, stand-up preparedness programs, whatever. He is very, very active, so he will likely be all over the world in your courses. But he is also, next to Jen, all 3 of those are really very communicative. Even though Gavin does a lot of traveling, he's always in touch with his students. He's big on using WhatsApp and having weekly meetings, Zoom meetings with his students. So he's always available. And then on the bottom row, on the left is Dr. Sestango. She has recently come on board. She has helped teach our PHP 594, our capstone course. Charlotte Roy is also a graduate of our program. She lives in Massachusetts. She has recently retired from the hospital system there, but most recently they called her back. She was the coordinator of hospitals in the COVID response, for example, for the state of Massachusetts. Scott Michelonis there in the center at the bottom and Keith McMinn on the right are they are employed by Penn State Health. Scott is the emergency management supply chain director for the Milton S. for Penn State Health. So you might want to talk to him about supply chain issues or emergency management. Keith McMinn on the far side just joined our faculty. He is, as I said before, the director of all the Lifeline services, which includes our airborne services as well as our on-ground services as well. Abram Flom is a emergency department physician. He was with Penn State Health, but he recently transferred to Wellspan in York, Pennsylvania, and he is directing all of their emergency management as well as coordinating all emergency management for South Central Pennsylvania. So he's not a Penn State member anymore, but he is still on our faculty and still available for internships. And we may even bring him back to help teach our hospital preparedness program. Just a couple of things to say about resources and courses. As a reminder, we do offer a student award for excellence, typically $500 for 1 or 2 students. It is awarded at the time of commencement, which is in May in Hershey, Pennsylvania. Jen is going to say more about the Penn State Library, the guidebook. We have a good relationship with University Park, so no one should use the excuse that they can't find resources or assistance from our library friends. The PHP, I'm just going to talk a bit about these 3 courses here, the 594, 596, and 597. So 594 is our capstone. This is a required course, 3 credits, typically comes towards the end of your program. Some students have taken it with 1 or 2 semesters to go, depending upon their own personal schedule. All are required to write a scholarly paper. Most students choose to do a systematic literature review. However, it is really up to the student to decide what topic and what format you want to do. As I said, most students do a systematic literature review, but we have also had students do a, for example, one student prepared an emergency response plan for her community for infectious diseases. Another student had surveyed their colleagues in the emergency management program, looking at their ability to abide by the standards for the profession. Other students have developed training programs. Other students have written a grant proposal. So the scholarly paper, again, comes towards the end of your program, and it can take many formats. The topic is totally your choice. We do encourage you to have sort of a local or content expert with that program, with your topic, because our faculty can't be experts in everything. So while we can guide you on writing the paper, we really do like to have people who have on the outside who have the content or expertise in that particular field. Most students take it as an individual course, but I would also strongly encourage you to think about coupling it with a PHP 596 course. This is an elective, and it is pretty much totally student designed. You can take it for between 1 to 9 credits. You can take it multiple times, but it really is a student designed course. It's also an opportunity for a student to do an internship and get credit for it. The internship is typically something that you as the student would arrange. We can help out. I've already given you a couple of contacts for internships. If that's of interest to you, we probably got more as well. For example, this past summer, we had a student who did an internship with Homeland Security, the Department of Homeland Security, where she was developing case studies for them, terrorist case studies for them. So, and I said it can be coupled with 594. So for example, we've had a student who during a 596 developed a survey instrument to survey surgery residencies to determine what kind of instruction they're offering for mass casualty incidents. And so she designed this survey, got IRB approval, and then began collecting the data during the 596. And then in the subsequent semester, she took her PHP 594, and she actually wrote that up as a paper, then as a manuscript. So that's an example of a student putting those two together to do a longer, more involved project than what you can do in just one semester. We've had another student, I've already mentioned her previously, during her 596, she held town hall meetings in her community to get community input on infectious disease response, an emergency response plan. And then in her 594 course, she put that together as the actual plan for her community. So that's another example of how students are coupling these two together to accomplish a bigger project, something that's going to take multiple semesters to really do it well.
I also just want to on the line about internships. I know Gene said that he had some contacts in the previous slide, and you can use us. But as Penn State students, please don't forget that you also have resources like career services available to you. And they've got amazing resources, including information on like the federal internships programs and things like that. So I know that some people kind of lose sight of that because they are going World Campus, but World Campus or in person, you are still a Penn State student. You are still, you still have access to all of those resources, mental health resources, career services, resume help, all of those things. So sometimes there is a World Campus option as opposed to the in-person option, but still you have access to all of those things. So please just keep that in mind.
Good point, Jen. Thanks for mentioning that. Appreciate it. And then the final course on this slide here is PHP 597, which is offered as an elective. This is special topics. I'll give you a couple. These are courses that typically are originated by faculty because of the timeliness of the issue. But if you have a special topic, a special interest or topic, please let us know, and maybe there would be some faculty and other students who would be interested in it, and we could offer it as a PHP, a special topics course 597. So I have two examples of these. Actually, I should have put the third in there as well. I will talk about the third since that occurred in 2022. We offered a COVID vaccine course. This was as the it was 2021, because as the vaccine was being rolled out, we offered the course to actually follow along as the vaccines were being developed and disseminated and promoted, and we were watching the outcomes of that as well. So that was a course offered in 2021 as the vaccine was actually being rolled out. Last summer, we offered an emergency management and public health course where we went through, and the first section was about public health, the capacity, guidance, standards, etc. And then the second part of the course was about emergency management, capacity, guidance, and standards as well. So what are the best practices of the field? And then students were involved with a case study, particularly the train derailment in East Palestine, Ohio, where they were actually doing surveys, interviews, and doing an assessment of the public health and emergency management response to that train derailment. And then the final 597 that I'll describe was offered this past summer. In addition to Jen and I, Amanda Clace was an instructor for that course. But this was on the impact of the COVID-19 pandemic. We were 3 to 4 years out, and we really wanted to go back and look what the literature, both the scientific and the government and the gray literature all said, and testimonies all said about the impact of the COVID-19 pandemic. It was very student-centered. It was students selected the topics. Students led synchronous discussions then. They wrote essays on pandemic leadership and research quality of the pandemic response. And these were the topics that we covered in our synchronous discussions: the SARS-CoV-2 origin, vaccine mandates, lockdowns, trust in information, substance use, and the WHO pandemic treaty. So that was a really fun course. I think we got very positive responses from the students, and is a unique course for them because it really focused upon reading and understanding the literature, and then becoming a leader within their among their peers for this course. Then as well. And we really did incorporate synchronous discussions into it. So it was really a very different sort of course, and one that I think the students and the faculty really enjoyed doing. I think that's my last slide. So why don't I pause and see if there's any questions or comments before turning this over to Jen. Did that answer some of your questions? Matthew's asking about the capstone. I think, right now, I am your academic advisor. I'm happy to talk to you at any time about courses or about ideas about the capstone or about anything else. So, yeah, just speak up. Let me know. I'd be happy to meet with you. Any questions or comments about what I've gone over? Matthew, Eugene, Adriana?
I think she had to drop.
Oh, she did. Okay. Okay. Okay, Jen, take it over and let me know when you want to advance the slides.
Perfect, thank you. Okay, so we kind of covered the information that's on this slide already, but we do this every Wednesday of first Wednesday of the month during the academic year. So start in September and go through May. We always start at 8. We usually end at 9. So we like to have our speakers come and talk a little bit. Some of them use slides, some of them just do a discussion. And then we like to have some time for question and answers. The people that we bring in are extremely interested in the field, and they are interested and interesting, and they're also really interested in helping out people who are advancing in the field. So they like that Q&A time. They like answering things about the work they're doing, about how they got where they are, and they're always willing to stay in touch. So I would highly recommend making it to our webinars if you can. If not, as I mentioned, we do record them every time, and we post them. Again, Chula Paul behind the scenes because he's awesome. He posts them to the PHP seminars link that you see on the screen right now. And we always advertise them as widely as we can. So you'll see them in your announcements, in your classes. They're on the PHS calendar, which that goes out in different distros, and also on LinkedIn posts, which I'll talk about more in another slide. Next slide, please.
Yeah, Jen, so we do have about 50 seminars in our library. So, and they are nicely organized and indexed. So, please make use of that. Their seminars are on specific topics, on internships, career development,
I should have mentioned
personal
that.
health.
We have everything from wastewater management to graduates of our program talking about how they've used the degree, imposter syndrome, disaster communication. We literally about 50 of them, and they cover everything. And we have had some amazing human trafficking. We've had a number of great speakers, so I would definitely recommend checking it out. If you're in 410, we are going to look at some of them in a later discussion forum, but there are a lot of seminars that you can use as resources for different topics, and also it's a wealth of networking information. I know we've talked a lot about emergency management in different slides. So we have a lot of students who are interested in emergency management and public health. And public health preparedness is a very broad field, and there is a lot of overlap with emergency management, especially when you're thinking about the 5 pillars of emergency management with prevention and mitigation and all of those. So if you are interested in emergency management, you are going to get a lot of both the EM side and the public health preparedness side. And you're going to see that a lot in your classes, but also as Jean mentioned, we do incorporate it into our electives. One of the ideas that we are kind of tossing around is doing some virtual tabletops. We tried that as part of an elective and it went over really well. So we were going to try doing that on a larger scale, maybe trying it like once or twice a year and getting more people involved in it that way. So look for announcements for things like that. I have another slide on this, but we also do have an well, we have an emergency management club and we are becoming official at Penn State. And once we get that signed off on, then we will be able to be an official chapter of the International Association for Emergency Managers. But that's something that we're really excited about. And if you are interested in emergency management, I would highly recommend checking out. I am you can use me as a contact for that and to get on the distro list and everything. But as I mentioned, I will have that in another slide. And guest speakers, we have guest speakers through the Emergency Management Club. We have them during our webinar series, and we will have them at different classes at different times. So if you're interested in emergency management, we do incorporate a lot of it into our classes and into our program. But if there's something that you're interested in that you are not seeing and something that you would be interested in, let us know. All of those electives that Jean talked about, well, most of the electives, are ideas that like a student had made a suggestion like, oh, I'm really interested in emergency management. And we were able to take it and run with it. That particular class came out of a student's capstone project. The COVID lesson learned came out of a student asking, hey, are we going to have any interesting electives this summer? So Jean and I talked about it a little bit and that came out of it. So let us know if there's stuff that you're interested in. If it's possible, we'll make it happen. And we're always looking for good ideas. So please let us know if there's something that you're thinking about. Next slide, please. Okay, so the IAEM student chapter. I know I talked about it a little bit already, but we are striving to do monthly meetings, and those are those can look really like whatever the students want. In the past, we've had guest speakers. We have talked a lot about the AEM and CEM credentials that are both offered through IAEM. We've had people who have done kind of emergency management mentoring. So one of the ideas that we had was to kind of take a poll of everybody who's involved in the club and figure out what your goal is. Are you just here to learn about different job opportunities? Are you working towards your AEM or your CEM? Are you working towards it and you need to find some professional opportunities, which we can help with? Are you done with all of the professional contributions and just need to study? We can do a study group. So there are a lot of different ideas that we have for the student chapter. And right now we are going to kick off this year on the 10th, so a week from yesterday at 8 p.m. I've posted the link a couple different places, but if you haven't seen it, please email me and I will send it to you. And when I'm thinking of it, okay, I just put my email address in the chat. Again, this is advertised the same place as the webinars. So your professors will be putting them in the announcements tab in your classes. It's on the PHS calendar. It's on LinkedIn. Again, there's a slide on that that's coming up. But we would love to have you. And in order to become official, we do need one more officer to volunteer. We have somebody who stepped up as president, and we just need a name as a treasurer. We don't do anything with money, so this is really just somebody who would be willing to step up and volunteer. There are some resources that are available for official Penn State clubs, which is why they want the treasurer on record. But being a virtual club, nothing that we've done so far has involved money at all. So if you're interested, please come to our meeting September 10th. If you're interested in being officer and taking that treasurer role, that would be great. And then I could submit the paperwork again. And please email me if you would be interested. That would be great. Next slide, please. Okay, so Jean had mentioned that we have a great relationship with our Penn State librarians. So the website for, well, actually, first I just want to make a general announcement. When your professors tell you to read an article for a class, or they put it as a required reading, please do not click on some link and think that you have to pay $50, $60 to read this article. We would never want you to pay that much, or we wouldn't want you to pay to read an article, regardless of how much money it is. So if we're putting articles in your classes, it's please always, always, always check the Penn State Library website and go through. Penn State Library is ginormous and has more subscriptions than I have forgotten the number, but it's in the more than thousands. So journals and newspapers and everything like that, you can access through the Penn State Library site for free, not having to pay for anything. So please make sure that you're using that Penn State Library site for your research. And actually, it's the beginning of this link right here. So libraries.psu.edu. But the specific thing that we wanted to call your attention to, well, actually, there are two things. One of them is that the Penn State libraries have librarians who, they will all help you with anything, but they do have librarians that are dedicated to specific fields. And Andrew Dudash is ours. I know it says political science, but he has been working with the public health preparedness, homeland security programs. And if you have a specific question about doing research in these fields, go talk to Andrew. He has done a number of webinars for us, which are in that PHP seminars link that was on the previous slide. And he will in those webinars, he walks you through how to use the library. And it sounds amazingly basic and it sounds crazy. Like, I'm a grad student, I know how to use the library. No, it's worth your time. It's about an hour, and it is amazingly worth your time to watch his webinar. Whenever now I hear somebody who's starting grad school, that's one of my first pieces of advice to them. Like, find a librarian and have them walk you through everything, because they know subject guides, they know how to search for things, and they will make your life so much easier. I met Andrew about 2 years after I graduated with my PhD, and I was kicking myself for not having somebody like him earlier. So one of the amazing things that he did for us was put together a library guide on public health preparedness with a number of resources. It's a living document. So Jean especially is constantly sending him things, like asking him how to incorporate it. So if you go to that link that's on the screen, the libraries.psu.edu guide subject, it'll bring up this the image on the right, guides by subject. And if you go to social sciences and law and hit that drop down menu, then you can find public health preparedness and bring up our library guide. And it's got, like I mentioned, it has a lot of really great references. So I would recommend checking it out now, like watching Andrew's webinar and checking out the library guide now, because it will be very, very helpful to kind of orient you when you get into doing the bigger research projects in your class, and especially when you start thinking about the capstone level. So that's something that Jane and I were able to put together with Andrew in the past few years, and we have been very grateful for his hard work with that, because it is a really great resource that we're happy to have. Did you want to add anything on that, Jean?
Yeah, well, thanks for the opportunity. I would also say strongly encourage, and I expect all of our students to be familiar with a reference manager, a citation manager. So our library does have Zotero and EndNote, web version of EndNote. available. Well, those are free anyway, but they do have a page with all the reference managers and guides on them. So I do expect students to be familiar with and use one of those tools to organize their writing and their reference list.
Again, that's something that will make your life a lot easier as well.
Right.
Okay, so on a number of the slides, I mentioned LinkedIn. So if you have a LinkedIn account, feel free to send me a LinkedIn request. Most of the professors that Jean talked about before are on LinkedIn and love to connect with people. So feel free to send connection requests. There are, if you're not as familiar with LinkedIn, in addition to the personal connections, there are also groups that are there. I'd highly recommend checking out there are a lot of public health preparedness, public health, CBRN, Homeland Security groups. So you can search for those, check those out. There are a lot of interesting job opportunities, things that are happening in the field, news, and all those sorts of things. So check those out because those are very interesting from a keeping you current perspective. From a Penn State perspective, and that's another group you can join as well. There's Penn State College of Medicine, Penn State Alumni, Penn State World Campus. But we have 3 groups for our public health, Homeland Security world. So the top one is our public health preparedness group. And this is, we've got faculty, we've got alumni, we've got current students. And it's a really great way for us just to share things that are going on, So things like tonight's webinar, or when we open up the school store, so you can get it, when you can order like Penn State t-shirts, or when we're talking about new courses that are being offered, or anything like that. It's a great way to stay in touch. It's a great way for us to get you information, and we also love to see what you're doing. If you come across like, oh, I work for this amazing this amazing public health organization, and we're hiring. You can post that sort of thing there as well to share with your Penn State colleagues. So top one, as I said, is our public health preparedness group. The second one is the larger Homeland Security group. That's not run by us, but we do participate in it. That's run out of Harrisburg. That's their thing. But again, they do a number of events. They have different webinars and things like that. So they'll post those there. That's another really beneficial one to join. And then the third one, the smallest of the 3, is specific for our IAEM club. And again, I'll post meetings there and different things like that. So that's another really great way to stay in touch. One thing that I did forget to mention about our IAEM club, but also our public health preparedness webinars in general, is that we are really happy with the way our program has grown and developed. And even after people graduate, they're still participating in our webinars. We have a number of alumni who are part of our IAEM club. One of them just got his CEM. We've had 2 people involved in the IAEM club get their CEM, which is a huge accomplishment. So it's not like you go through our program, you take your classes, you graduate, and then you just disappear into the void. We are really proud of the fact that we have grown this community and developed this community to be a place where people graduate and they still stay engaged. They still come to our webinars because they're that beneficial, that they want to hear what kind of new information is in the field. They want to come to our IAEM meetings and help themselves get their CEM and bring in guest speakers and help other people advance and things like that. So we are really excited to have these initiatives be enjoyed by current students and faculty and alumni. So as you're going through our program, just know that we're really excited to have you here. And even after you graduate and you go off and you do more great things, we still love to have you here, and we're excited to keep those relationships going. Next slide. I was gonna say that might be my last one.
Yep, that's it. Yeah, so thanks, Jen. Good explanation, good overview. Yeah, I hope that has answered some of your questions. And does anybody have any other questions? Anything we need to go back and highlight or explain further, clarify?
One thing I will say, it's not specific to public health or anything like that, but I know I mentioned that we are always available if you have questions or anything like that. That extends to, like, if you have something that's going on and you need an extension on an assignment, if you've got some family issue going on, if you lost your job and you're having a horrible week, let us know. The people who are here, we are really, really fortunate to have a really great program with people who are very dedicated to the program, to the students, and we want to help, and we can't always do that if we don't know. So feel free to reach out. If you've got something going on, ask for an extension. We also understand that this is a professional program, so you're not a 100% student, 24 hours a day. You've got work stuff that comes up. This is emergency management, public health preparedness, homeland security. So, when something happens, you don't always have notice. You're getting pulled out the door to go respond. So we understand that, and we're here, and we want to support you both as students, but also as people and as professionals. So let us know. We are here for you, and we want to do everything we can to help.
Very good.
Thanks.
Okay. I don't see anybody going off mic or notes in the chat. So, well, thank you all for joining in tonight. Again, we will post this in our library, and you or your colleagues can view it at another time too, as well. So, like Jen said, we are always here and are eager to work with you to investigate a particular topic, particularly one that is of interest to you as a student or in your professional life. Okay, thank you all. Have a good evening.
Thank you so much. Good night.
Bye-bye.